What is the term? Mobility. Yeah, that's the point. It's not anything extra happening in the body. When you talk about a caries, the possibility of a caries is already there. Clear? Means, yeah, there is a balance between demineralized enamel or demineralized tooth structure and remineralization by saliva. It is already there. So every moment caries is happening, but there is another mechanism that will retaliate and remineralize the area, which will prevent the occurrence of real caries. Otherwise, caries happens even otherwise on a tooth. Every moment there is demineralization happening, which is otherwise caries. Which is otherwise caries or the beginning of caries. But it doesn't happen because it gets remineralized by saliva. So once that balance gets disrupted, that will result in the so-called caries. You get this point? You get this point clear? Similarly, when you talk about mobility on a tooth, mobility is even otherwise there. But that is within the confines of periodontal ligament area. Within the confines of your chair you can move. Yeah, this is possible. Right? But what happens when your chair gets totally, what will happen now? You will fall down. So that movement of tooth is even otherwise there. Now what happens when the bone metabolism, bone gets resolved, that will result in increase in mobility. It's not that something else is happening here. It's the same mechanism which is otherwise protecting you. That becomes the same mechanism that is protecting your tooth from getting fractured. The same mechanism that helps you in chewing. The same mechanism that helps in getting proprioceptive effect on the tooth while chewing. All those become hazardous, or all those becomes pathologic. The same mechanism becomes pathologic. You get this point? Bone gets remodeled by itself, like tooth. The bone around the tooth gets remodeled by itself. Bone remodeling. Is it the same bone what you had in your body when you were born? What you are having right now? Nothing in your body is same. Maximum 12 years time. Within that time, the entire body is changed. Whatever you say you were 12 years before, you don't have anything in your body right now. Yes or no? Yeah. Nothing in your body is the same. Everything gets renewed and remodeled. The same mechanism happens in the bone as well, right? Now in periodontitis, what is possible? Whatever is supposed to be remodeled or regenerate will not happen. So what result? What does it result in? Loosening of tooth. So is this another mechanism that is happening during pathology? No. It is the same mechanism which was otherwise there, somehow got disrupted, and the balance got disrupted. More of destruction, less of regeneration. Did you understand the term? Regeneration. Your which generation you said? Which generation? Gen Z generation. Your parents belongs to which generation? What will be your next generation? So we are talking about generations, right? So you had a previous generation. You are the present generation. You have another generation to follow you. Am I right? So this is called generation after generation, means Means there has to be something preceding you. There has to be something preceding you. Right? Then you call it generation. So what do you mean by regeneration of bone? There has to be bone to regenerate bone. It's not that you can create something. There has to be bone for bony regeneration. It's not that you will put some bone graft in one place and that area will start regenerating bone. No. For regeneration, you need to have bone there. You understand this? So that is what is the concept of balancing the lost and the forming bone. So bone has to be there. So bone has to be there for bone to remodel. Once that balance between this lossing and regeneration happens, the tooth will become mobile. You understand this? The same mechanism what you explain caries. Demineralization, remineralization. Here what is it? Bone resorption and bone regeneration. When there is a balance lost between these two mechanisms, that will result in what? Tooth mobility. Because ultimately it is bone that is holding the tooth. Bone is holding the tooth. When I say I am holding this cast, does that mean my hand by any chance is ankylosed to this? No, I am just holding it. Similarly, bone is holding the tooth. Bone is holding the tooth. So the tooth is inside a bony socket. That doesn't mean that the tooth is directly fixed to the bone. There's got something in between to take up this shock absorption. That is periodontal ligament. So as we said, a tooth, it has got a bone around it and a gingiva investing it. So this bone is ultimately holding the tooth, not directly but through periodontal ligament. So bone is not directly in contact with the tooth. It cannot be in contact with the tooth. If at all it comes in contact with the tooth, that will start. What will happen if a tooth directly comes in contact with the bone? What will happen if there is a direct contact between the joint, the TMJ joint, and the fossa where the bone is? One of those surfaces will get worn off. It will wear off. It doesn't happen. In the TMJ, it is so well protected by so many things. There is a capsule to protect the mechanism, and there is a disc in between. Everywhere there is. So there is never nowhere a bone gets in contact with another bone. If a bone is in contact with another bone, then there has to be a joint which has got some kind of a soft tissue between these two surfaces. Otherwise that will start wearing off. So it doesn't happen in a tooth as well. So there is something that is holding the tooth and the bone together, that is periodontal ligament. This is where we stopped last time. So by any chance, if there is an excessive force here, and there is an excessive force, what will happen? What will happen? When there is an excessive occlusal load, what will happen to this area? What will happen? There will be a series of mechanisms happening, which collectively we call it injury from occlusion. Means trauma from occlusion. So when there is an excessive load onto this tooth, that is going to result in trauma from occlusion to which portion of the tissue? Is it going to happen in the gingiva? Is it going to happen in the periodontal ligament? Or is it going to happen in the alveolar bone? Or is it going to affect all these tissues? When there is an excessive overload or an occlusal load onto this tooth from any direction, or you happen to place a filling which is overextending. You call it high point. You placed a amalgam filling, and that amalgam filling happened to be over contoured or over placed. You call it a high point. And there is a high point on this tooth. Naturally, this point is going to come into contact with the opposing area, right? With the opposing tooth. This will generate too much of load onto this. A force which was supposed to be borne by the entire teeth is right now borne by a single point, because that comes in contact first. Am I right? So the entire load what was supposed to be borne by the entire occlusal table is right now concentrated in one point, because you have placed a high point on one of the restored area. So that is going to definitely give an extra load to this region. So there is a gingiva here, there are periodontal ligament and gingival fibers. There are numerous periodontal ligament fibers connecting the tooth and the bone itself. Right? Now which area is going to be affected the maximum, or which all areas can it affect? Because of a trauma from occlusal load. Which area is going to get the injury? Will it anyway affect the gingiva? Will it affect the gingiva? You all have a cast in front of you, right? This is what I am talking about. When there is an occlusal load, excessive occlusal load onto this tooth, which area is going to affect it? Which area is going to affect this? Will it affect the gingiva? Is gingiva directly bearing the load? See that? See the picture and see. Is this tissue that is investing the entire periodontium? Periodontium consists of cementum, periodontal ligament, alveolar bone, and the gingiva. So gingiva is the investing structure. Supporting structures are cementum, periodontal ligament and alveolar bone. So which all structures is this occlusal load going to affect? Let me make it very clear to you, it doesn't affect gingiva. The occlusal extra load is not going to affect the gingiva, because the only purpose of gingiva is like a cloth you are wearing. Somebody hits on your head, definitely your tail is going to affect, not your cloth. So it's just the investing structure of the periodontium. It's just invest and stays there. The load is going to be borne by which all area? The load can be compressed within this periodontal ligament area. It's going to get compressed. It's going to get compressed into the periodontal ligament area. What will happen when the occlusal load exceeds? When the occlusal load exceeds the adaptive capacity of this area, what will happen? What will happen? This area will start getting remodeled. This area. The area of bone immediately or in proximity with the periodontal ligament area will start getting remodeled. Why should it get remodeled? Why should it get remodeled? See, imagine what will happen if you place an orthodontic band over here and try to move this tooth to one another direction. What will happen? You have learned about it. The bone over here will get resolved and the bone over here will get deposited. Right? CCC, the same thing. So when the occlusal load is directly hitting the tooth, what will happen? The area over here, the entire this area will get remodeled. Now does that mean the bone is fractured? It doesn't mean that the bone is fractured, and the reason for this is to prevent the bone from getting fractured. When you apply an excessive occlusal load, the same thing happens when you apply an orthodontic force to the tooth as well. When you apply an orthodontic force to the tooth, it is same as applying an occlusal extra load to the tooth. What will happen? Some bone has to remodel. Otherwise, either the tooth will fracture or the bone will fracture. So it's an adaptive mechanism. It's an adaptive mechanism. So the bone over here will resolve. What will happen to the periodontal ligament? Is this a protective mechanism? Is this a protective mechanism? Is this a protective mechanism for to withstand the extraocclusal load? Protection. So the mechanism is to protect the tooth. Mechanism is to protect the periodontium. Mechanism is to protect the alveolar bone. Mechanism is to protect the TMJ from getting dislodged. So the entire mechanism is what? Entire mechanism is protective. Protective means what will happen to the periodontal ligament over here? Is it going to get fractured, ruptured? Will it tear? It won't. Nothing happens to the gingiva and nothing happens to the periodontal ligament, but it gets elongated because right now the bone is here. The bone got resolved to adapt this extraocclusal load. How will it adapt the extraocclusal load? By giving more space in between the tooth and the bone, so that can compress more into it, right? So what will happen? The net result is bone will resorb over here, periodontal ligament will get elongated, and the space between the tooth and the bone will increase. The net result is what? Net result is what? Tooth becomes mobile. Tooth becomes more mobile because periodontal ligament is there, alveolar bone is there, but alveolar bone has resolved in such a way that periodontal ligament space will increase. Periodontal ligament space will increase. We see an X-ray of a tooth having trauma from occlusion. The space in between the root and the bone will be more. Why is it more? To adapt the extraocclusal load that is right now acting on this tooth. So when there is an extraocclusal load from here, this area gets compressed, right? So there will be bone resorption here. Periodontal ligament will lengthen itself, or the periodontal ligament space will increase. Naturally, the tooth can get displaced more, right? And the entire area will get protected from fracturing this bone. So the bone resorbs to prevent fracture. Is that understood? So trauma from occlusion will result in what? Tooth mobility. But did you lose gingiva here? You didn't lose any gingiva. Did you lose periodontal ligament here? Did you lose bone? Yes, you lost bone, right? Now reduce this occlusal load. You're going for reduction of this extra amalgam that you have placed on the tooth, or extra restorative material you have placed on the tooth. That extra composite, that extra amalgam, that extra crown, that extra inlay, that extra onlay, whatever you have placed on this tooth, once you trimmed it down to the normal level, establishing a normal occlusion with the opposing tooth. Now what will happen? There is no need for an extra accommodation of occlusal load here. What will happen? What should happen now? Bone apposition again. Bone will form back. Bone will form back. The periodontal ligament will naturally go back to its normal length. the entire thing is restored back. Mobility reverses. You understood this mechanism? Is that clear? I don't think there's any doubt in this. So the mechanism was injury to this area. An injury. What happens after an injury? It heals. So naturally, when there is an extra-occlusal load, there will be injury to the bone area. There will be injury to the periodontal ligament area, but these are all reversible. So when there is an extra-occlusal load, which we call as injury resulting from occlusion, trauma from occlusion, this mechanism happens here. So this is a kind of transient mobility which can be rectified. This can be rectified. It's not just an extra-occlusal load because there is a high point or any kind of an iatrogenic problem you have created. This could be because of many other reasons also. So trauma from occlusion has got various reasons. It need not be from the magnitude. This is extra magnitude. That could be because of a difference in position. There could be disturbance in the distribution of the force. This could be because of an extra frequency of usage. So it's not just magnitude of the force, direction of the force, the frequency of force. You get this point? When there is a tooth which is rotated tooth, this will cause a difference in its direction. When there is a cross bite, there is a difference in its direction. So it could be magnitude, frequency, duration and direction. Any change in a normal occlusal load changing into pathology will be based upon these four factors. An extra force, that is magnitude. Direction, cross bite. A rotated tooth, direction changes. Frequency and duration, that happens in clenching and bruxism. You need to have certain rest in the night. That time also, if you have started to using the teeth, that is in case of bruxism, that will result in trauma from occlusion. So extra load can lead to mobility. Now when we are talking about the mobility resulting from periodontitis, when we are talking about the mobility resulting from periodontitis, the change in this mechanism is something else. This mechanism is not the same. This mechanism involves gingiva also. When you are talking about periodontitis, we are talking about a mechanism, a pathology involving the gingiva. Imagine this gingiva has gone down in this mechanism. If this gingiva is right here, by taking away the reason for that extra occlusal load or anything, will the bone resorption will go back to the original level? It cannot, because the gingiva is already receded down. So in periodontitis, this mechanism changes into something else. It's not trauma from occlusion that is happening here. It is the entire loss of this periodontium, including gingiva, the connective tissue, the bone, the periodontal ligament and gingiva, alveolar bone, periodontal ligament and cementum. In periodontitis, there is a loss of entire periodontal structures, including its investing structure. So first what we learned was a trauma from occlusion that is totally reversible. Now we are talking about a disease called periodontitis. Again, that itis come here. It is again what? An inflammatory process. An inflammatory process that will result in a loss of gingiva, connective tissue, the fibers here, the fibers that hold the gingiva tightly onto the tooth, that is lost. What else is lost? Alveolar bone, then periodontal ligament and cementum. You got it? So all these structures are going to get lost, and there is no question of it reversing back. The reason is the investing structure is lost. Whereas in trauma from occlusion, the investing structure was there. So what is the importance of this investing structure? This gingiva. What was the importance of this gingiva? It was holding the position of this periodontium without being receded, so that the entire structure underneath can get remodeled. It never gave way. It never gave up. Gingiva was still holding the tooth in the CEJ level. The entire mechanism was happening inside it. So gingiva was protecting this mechanism. The entire mechanism was happening inside it. Tooth was undergoing trauma from occlusion. But once you get rid of this reason, once you got rid of this extra occlusal load reason, the entire thing will reverse back. Because gingiva was still holding it. If gingiva goes down, then there is no question of the entire thing coming out. This is what is happening in periodontitis. So gingiva, if gingiva gets detached from here, if gingiva gets detached from the CEJ region, then definitely there is no reversal back of this process. Is that understood? Now how does that happen? What should be the reason behind this? What should be the reason behind periodontitis? The reason behind periodontitis, let it be anything, but it is a body programmed mechanism. So periodontitis is a body programmed mechanism. Means body is doing it. It's not that microbe is doing it. Microbe is there in each one of your mouth. The same kind of microbe is there in everybody's mouth, which is there present in a severe periodontitis person's mouth. All those microbes are there in your body. It's not that a person having periodontitis have got an extra kind of microbe in his body. Streptococcus mutants are there equally distributed in all your mouth. All you people have got Streptococcus mutant, but caries doesn't happen in the same way. Caries doesn't happen in the same way on a tooth like the other one, not like in nearby tooth. It happens in a very weird way. It happens in a very specific way. It happens in a site-specific way. It might happen in the proximal area, caries. It might not happen in the occlusal area. It might happen in a molar area. It might not happen in an incisor area. It doesn't have a true uniform kind of a distribution. Caries can happen on any tooth, on any surface. Whichever surface it involves, it won't be the same on another surface of the same tooth or another tooth in the same oral cavity. Or it doesn't happen the same way between two individuals. Similarly is periodontitis. All those microbes which you can attribute to the formation of periodontitis is present even in your mouth. The same periodontitis causing microbe is there in your mouth, but it doesn't cause periodontitis. So what is the result? What causes periodontitis? What causes periodontitis? The word says it's periodontitis or inflammation. Inflammation means? Inflammation means what? Inflammation means what? Is inflammation a destructive mechanism or a protective mechanism? Are you sure? Are you sure? See the features of it, the cardinal signs and symptoms of features of periodontitis. Color change or increase in color or difference, a color difference that will result in increase in the blood supply to an area. Increase in blood supply is naturally or purely a protective mechanism, because that is how body brings all those chemicals to that area or cells to that area to protect it, right? So that will result in an increase in red color, an increase in the color because of an extra supply of red color solution to that area. It becomes red, right? It becomes red because of hyperemia, an extra supply of blood to that area. So when there is an extra supply of blood, naturally that will result in an extra red color in that area. So there has to be a color change. When there is an extra blood supply to that area, that will result in extravasation of the product of blood, that is edema, naturally needed for protective mechanism, which will go on forming increase in temperature, that will cause an increase in pain, and finally result in loss of function. That will result in loss of function. That area will lose its function. Like, for example, you happen to break your hand. You happen to break one of your long bones. What will happen there? There will be increase in color, an increase in fluid. There will be increase in the pain sensation. There will be an increase in temperature, and finally, you won't be able to move the hand anymore. Loss of function. You cannot function anymore. It happens in the heart. There is an increase in that, and finally heart will stop. Same thing happens in any organ. When there is an inflammatory process going on, that will cause a lot of disturbance to you. Right? That will cause loss of disturbance to you. That disturbance is what you feel. Even otherwise that was there, but that was in balance. Like we asked somebody last time, do you have blood pressure? Who was that? I asked you whether you have got blood pressure. You have blood pressure, but you are not feeling it. Right? You need blood pressure, right? When there is an increase in blood pressure, she starts feeling it. When there is a reduction, when your blood pressure falls down, you will start feeling it. Right? These are all part of your inflammation. But you won't feel that thing happening. When you feel that thing happening, that is what we call it as disease. So without a body response, nobody can live. Your body is constantly responding to everything. You want oxygen. You want a lot of gaseous exchange to happen in the body for the mechanism of energy production. You want it, so you are breathing. But you won't be knowing you are breathing. You are not knowing you are breathing. You are not knowing blood is circulating in your body. You are not knowing all these things happening in your body. Similarly is your inflammation. Inflammation is host response. When you need oxygen, you are breathing. That is happening. When you need an extra oxygen, you start breathing more. When there is an obstruction in your breathing, you will start breathing in such a pathologic way, we call it asthma. So inflammation is a normal process that is happening. The normal entire process that is happening here is part of inflammation. I am talking about periodontitis disease. So periodontitis even is otherwise also happening here. This gingiva is getting renewed. This bone is getting renewed. Periodontal ligament is getting renewed. Cementum is getting renewed. Even otherwise it's happening. But here what happens? That area was getting renewed to the certain amount or the required amount of resorption. Bone was getting resorbed, bone was getting regenerated. Periodontal ligament was getting slowly resorbed, it was getting reproduced, regenerated. Cementum was happening, the same thing was happening in cementum, the same thing was happening in gingiva, the normal inflammatory process was going on fine. But now what happened? Now it is only destruction or no regeneration. That is to happen here. So for that to happen, For that to happen, you need a stimuli. You need a stimuli. Certain stimuli that will cause destruction, not regeneration. But the process is carried out by body itself. So the mechanism is right now initiated from somewhere which has got a signal to this body. A signal has come to the body saying that don't respond with regeneration, let it destroy. Resorption is happening in the body, totally controlled by what? Resorption is controlled by what? Is there any extra thing or extra substance coming here to resorb this bone from somewhere else? It is inside the body. Is there any extra thing that is coming to that area to resorb the bone? Is there any extra thing produced in that area to resorb the bone other than the normal things that is required to resorb it? Bone has to be constantly remodeling, right? So there has to be a mechanism that will resorb the bone and regenerate, right? Yes or no? This area, the bone is constantly getting remodeled, right? It was getting remodeled. It was getting resorbed and regenerated, deposited. That was happening there, normally happening. So on a normal gingival or a normal periodontium, all those structures are resolved by anything from outside or from the or within the body itself. Is this bone resorption happening because of something being supplied from somewhere or within the body, supplied by the body's own things? Which way is it? Body's own thing. So anything that is required to resorb this bone is supplied by the body itself. What are they? Which is the cell that result or which will cause bone resorption? Is osteoclast supplied by somebody somewhere or micro from somewhere? Or is it body product itself? Which is a body product very much present here itself. It's present there itself. So osteoclasts were resorbing it. And which was the structure, which was the cell that is producing bone there? From where did it come? It was there. So the mechanism was there. Gingiva, which is that structure that kills gingival cells? Which is that structure, which is the way which an epithelium loses its cells? Which is that mechanism where epithelial cells loses its and exfoliates off? How does gingiva exfoliate its cells? It's a normal mechanism of keratinization. From the basal layer, the cell comes and gets exfoliated off. And which are these cells that is present in between the junctional epithelium and the bone here? They are fibers. Gingival fibers and periodontal ligaments. Gingiva, alveolar bone, cementum and fibers here, right? Lot of gingival fibers and periodontal ligament fibers. They are all made up of what? Those fibers are made up of what? Collagen. Which cell produces collagen? Which cell kills collagen? Yes, the same thing. So fibroblasts produce collagen. Fibroblast itself will lyse collagen. There's an enzyme produced by fibroblasts that lyses collagen. Which is that enzyme? An enzyme that kills collagen is what? Collagenase. Both are produced by what? Fibroblasts. So the area here, if you see, this area has got fibroblasts which has got the capacity of destroying the collagen and depositing the collagen. Alveolar bone we already said. The same thing with periodontal ligament. They are again collagen fibers. So it is the same cell that produces it and destroy it. If body asks it to destroy more, it will destroy more. If body asks to reproduce more, it will produce more. If body has asked something to produce more, it will produce more. That could be even the resultant of cancer. It doesn't come from outside. Body asks to produce it more, it produces more, results in cancer, you die. The same thing. So it is not supplied from outside. So the mechanism is crystal clear. Whatever is required here including the cementum, the periodontal ligament, the alveolar bone and the gingiva, they are all controlled by the body itself. Only mechanism right now is body is asking those tissues to what? Tell. Protect. Or just go destroy. Or just go destroy. In periodontitis, body signaling those areas for what? To destroy. Body is asking fibroblasts not to produce collagen anymore. So fibroblast doesn't do that because the entire thing comes under the control of the body. Body is asking gingiva not to produce any more gingiva. Body is asking alveolar bone not to produce any more alveolar bone. Body is asking cementum not to produce any more cementum. Body is asking periodontal ligament not to produce any more periodontal ligament. Now what will happen? Naturally, only the resorption will happen. It doesn't produce any more. Am I right? Am I right? Is that understood? This is why it's called periodontitis. So who controls this? Body. Now the question, why? Why should body be against a tooth? Why should body be against this tooth? Why should body be against this tooth? It was very well in harmony. Tooth was very much harmonious with the body's otherwise health. You are having teeth in your mouth. Body doesn't ask all these cells not to produce anything more when it is in your mouth. Why is it giving such a signal in a patient's mouth? Why is it giving such a signal in patient's mouth? It doesn't give the same signal to any other parts of the body. What if it had given the signal to the eye? Your eyeball would have popped out. It would have got lost. What if body had asked to do the same thing in any other part of the body? That area, that organ would have got repelled. You understand this mechanism? Everywhere it is being held by the same tissue, right? Here also it's bone, there also it's bone. Everywhere it's bone. If not bone, it's soft tissue. The body gives a signal to the one holding your heart to reject it. Definitely the entire area around the heart will reject it. And what will be the net result? Heart will be ejected out. Tooth is the only one organ wherein body gives such a signal and that thing happens. So this is the only organ in the body, which at certain condition body asks not to regenerate anymore, not to give any help, no more financial, no more energetic help, nothing, no more nourishment to that area, let it die. The only one similar organ in the body. That is the reason why we have got an undergraduate course called BDS and around 9 postgraduate specialties in this science, which is in no way similar to the rules and regulations of MBBS. The same thing what we asked the other day. You happen to be in final year still. You have not done much of extractions. And your relative starts asking you, have you started to do extraction? What is the answer to them? What is the answer to them? We are here not to learn how to extract tooth. We are here how to preserve it. That is the answer. Possible, the only possible answer right now at this point of time. But will anybody ask an MBBS person who is studying in final year, have you started extracting eyes? Have you started extracting nose? Have you started extracting heart? Have you started extracting liver? Nobody. The only possible question of similar kind is to a dentist. Have you started to extract teeth, which is actually your bread and butter? There is no teeth in somebody's mouth, then where are you going to do your work? So this particular thing that makes a tooth appear to be an extra organ which is to be expelled out in case of a need makes this size unique. Got this point? So which is that factor that causes or asks the body to reject this tooth? No more supply, no more support to that particular thing. Let it go. See, body is under a constant threat. Body is under a constant threat from their guest. Elsewhere in the body, when there is a threat by any microbe that is sitting on your skin, it can react very well. It is no way going to enter your skin. You may be having a lot of dirt outside here, but this is not going to enter your body. It will stay outside. Your skin hosts microbes. It is very well protected and kept. There is no threat from it as such, unless you have got a cut over here. You scratch this area, then there is a possibility of microbe entering. You have a cut over here, an injury over here, then there is a possibility. Unless and until you have an injury, microbe cannot enter. Even in an injury, if microbe enters, body knows how to manage it. Body has got cells that are not fixed, that are moving, migratory, that are flowing. Your neutrophils, they are not fixed cells. They are flowing in the entire body. They can come to an area in case of a need. They will all come like an air kind of a defense, air defense. They are not fixed cells, right? All your WBCs can flow through your blood, come to any location where they wanted, right? So you have got a mechanism inside the body that will not just physically protect microbes from entering, but it can fly down to that area and protect that area. They are your WBCs and similar kinds of humoral mechanism, cellular mechanism, everything can move anywhere in the body and do the protective mechanism, right? So inside a body, all your organs are within the protection of these cells. Now if you see this particular one organ, this is a hard structure or a hard tissue projecting from the soft tissue, which is projecting from the soft tissue and stay unprotected here. The periodontium is very well inside your body, but your other part of tooth is not. Enamel is right now, or enamel is once it's erupted, it is seen open in the oral cavity, exposed to microbes without the protection of your blood. Am I right? Elsewhere in the body, every other organ in the body is protected by blood. It has got a vascular supply to it, vessels encircling it, blood always, all the time blood is circulating through it and over it, and it is giving him its protection. But this particular crown portion of the tooth has got no protection. No protection. Blood supply as such, WBCs cannot reach the enamel to protect it. The only one structure similar to that. If you talk about other organs, maybe you can think in terms of two other structures. One is nail, the other one is hair. So if you compare hair and nail, somewhat similar, but their structures are totally different, and the kind of structures that they defend is also different. Oral cavity is having the maximum number of microbes around it or inside it. An entire microbe is seen harboring on this tooth. It's harboring on this tooth. The microbes are continuously, constantly harboring on it and building up, building its colony on it. Now, what is the protective mechanism? The only protective mechanism it can get is saliva or GCF or similar things. But how long can it protect it from accumulating on its surface? It cannot. Your saliva cannot prevent microbe from accumulating on this tooth structure. In fact, it's supplied with food. It's supplied with minerals. It cannot protect in any way. So if by any chance a microbe is there on this tooth, on this enamel, see, imagine a colony, microbial colony on this enamel, and body knows very well that thing is getting harbored. Now what will body do to it? How can body prevent microbial colonization on the tooth? How can it prevent from microbes getting colonized on this tooth? What can it do? It can do nothing. Body cannot do anything to prevent microbe from getting accumulated on this enamel. Am I right? Am I right? If it is happening inside your body, you will start developing fever. You will start developing fever. Body will resist to such a level that all your microbes in the body, all the kind of pathogenic microbe that has entered the body will be totally killed in the body itself. But what can body do to this particular enamel? Nothing. Nothing can be done. Just imagine if a microbe gets colonized here. As such, it is a threat to the body, but it doesn't enter the body. Right? And no microbe is going to be there anywhere on the root surface because it is totally protected by the body. What about one area? One area on this entire complex. I know I have dirtied it to maximum, but can you tell me which is that area? Which is that one area wherein microbe may enter your body and body is always under constant watch and constant surveillance? Which is that area in this? Not the enamel in the outside which is exposed to the oral cavity. Let it colonize there. Not on the root surface which is under body's control. Which is that other area? Sulcus area. Sulcus. If I take this particular thing outside and draw here, it will be something like this area. I am talking about this area. So which is that structure that safeguard there? Junctional epithelium. Junctional epithelium comes and cuff that CEJ region and keep. It's just an epithelium, junctional epithelium, which is not even strong enough to hold it like a skin. What kind of a keratinization is seen in junctional epithelium? You have got orthokeratinized epithelium, you have got parakeratinized epithelium, you have got non-keratinized epithelium. Which epithelium is seen in junctional epithelium? Which kind of keratinization is seen in this junctional epithelial region? These cells. What about your skin? What is that? Keratinized, I agree. Which keratinization? Ortho, para or non? Ortho means completely keratinized. Para means keratinized but not to that extent. Paramedical staff means what? They are not doctors. They are not doctors. They just come one step below the doctors. Para. You have got para troops. You have got para army officials. They just help them. They help them. But they are not the thing. So, orthokeratinization is completely keratinized cell layer, that epithelium. What do you mean by that? The basal layer cells have completely matured and reached the final corneal layer. It has gone through all the steps, wherein once you pass each step, you will get more chemically modified and morphologically modified. the cell as it migrates from the basal layer gets flattened and get filled with what? Filled with a protein, which is that? Keratin. As it passes through each layer, as it passes through its basal layer to granulosal layer to spinosal layer to corneal layer, each of this layer, the cells get flattened and flattened and flattened, and finally it will be having a total detachment from the nearby cell and totally filled with keratin without even a nucleus inside it, and it gets exfoliated off. This process is called keratinization. It's a process of morphological and chemical changes that happens in a cell as it migrates from the basal layer to the surface layer. That is what is keratinization. So the final cell layer in that particular cell will have nothing in it except for keratin. This process is called keratinization. So that final layer that is seen on your skin surface is so totally physically so fit. Physically it is so much strong. When it is parakeratinized, those cells are not completely keratinized. Some amount of nucleus are still there. Some amount of cell will have space for more keratinization into it. That is parakeratinization. Okay, they are not MBBS, they are BSc nurses. You got this point? You understand this? They are not dentists, they are diploma holders. They are paramedical stuff. Similarly, parakeratinization. Now, do you know what kind of an epithelium is this gential epithelium? They are not even parakeratinized. They are non-keratinized. There is no remnants of keratinization here. All the cells are young and vital. Very well, very sensitized to anything or everything that is happening here. Even the smallest amount of stimuli in that area has to be felt and passed on to the next level of defense mechanism. Something like every light ray has to pass through your retina. Now your retina cannot be super thick like your skin. Your retina cannot be as thick as your skin because it has to pass light through it. Am I right? Similarly, any small stimuli in the sulcus area has to be felt and passed on to the next level of defense to come in. You get this area? You understand this area? So they are non-keratinized, not keratinized at all. They are very transparent kind of cells. A very young cells which will definitely protect this area to the maximum, but at the same time gives a signal. The sensation is passed to the underlying structures asking the next level of defense to come in. The microbes are there waiting outside in the sulcus. Be protected to the other mechanisms. So what are these other mechanisms? The other mechanism to come in needs blood vessels. Because inside the blood vessels you have what? Inside the blood vessels you have what? The flying defense cells. Your neutrophils, your lymphocytes, all those things are there in the blood. So these cells will have to withstand the microbial entry by a physical barrier. On top of it to pass signal to the underlying blood vessel to send in the flying defense cells, neutrophils to this area. Is that clear? So these cells are meant for these two purposes, not just to defend it by a physical means, instead to send the signal to the blood vessel to send in the next level of defense to this area. Is that understood? So this is non-keratinized cell layer. Understood? So between this gential epithelium cells have got its own resident leukocytes. Gential epithelium and sulcular epithelial cells have got resident leukocytes or the WBCs that resides there. Can you name one? WBCs that are seen in the suprabasal layer of junctional epithelium. Big cells which has got pseudopodias. Langerhans cells. So they are cells even in the epithelium which has got a capacity to resist it. So they are all resident leukocytes. Then you have got similar WBCs in the connective tissue here. They are also called as resident leukocytes. Can you name many of those resident leukocytes which are readily present in the connective tissue, which need not be brought from anywhere? Can you name one? Yeah, I think somebody answered. Who's that? What is that? A cell that has got a capacity to produce a chemical. A cell that has got a capacity to produce a chemical that will dilate the blood vessel so that blood products can come into that area. That is very much needed here, right? Blood vessel is there. Blood vessel has to be dilated. Vasodilatation. Vasodilation helping WBCs which are resident there. Anything goes wrong, the blood vessel has to be dilated and cured. That's enough. Rest what to do, blood vessel things inside, circulating things will do. So the circulating things have to come to here means blood vessel has to dilate. So which is that chemical that will cause dilation of the blood vessel? A chemical that has got a capacity to dilate any smooth muscles. That chemical is called histamine. So which is that cell? Chemical is called histamine that results in allergy. So it's mast cell. So mast cells are seen residing here. So anything goes wrong here, a signal from the microbe that will result in mast cell degranulation of histamine, which will result in, what will it cause? Dilation of the blood vessel, increase in blood supply, right? Increase in blood supply will result in what? Increase in color, increase in edema, right? So the sign of inflammation has started to see here. Sign of inflammation has started to see here. Even otherwise blood was circulating. Even otherwise blood was circulating there. Even otherwise neutrophils were circulating inside. But they were not present here. They were not invited here. Right now the invitation comes. Then comes the entire process of endothelial migration of WBCs. Otherwise, no need. WBC circulates in the blood vessels smoothly. Inside the blood vessel, WBCs just circulates and move on and on. It just circulates inside the blood vessels. They are not invited here. They will be flowing. Those neutrophils will come, inspect, roll and go on. Have you heard this mechanism? Rolling arrest, diapedesis, zipper phase. You heard about all these things, right? So that is how neutrophils comes out of the blood vessel. That is the mechanism. When there is no threat, no need of neutrophil. If there is a threat from any microbe, then this neutrophil has to come out and migrate to this area and come here and stay and defend it. What is mechanism, right? Did you get this? So normally neutrophils circulate in the gingival epithelium, connective tissue. It circulates in the blood vessel in the connective tissue. There is no need of any neutrophil to come out from the blood vessel, it just circulates. When there is a signal from the epithelial cells, that there is a threat outside here, neutrophil migrate to that area. Naturally, that is the defense. That is the defense. That is the normal way of defending it. Because your epithelial cells alone cannot do the job now. When epithelial cells cannot alone do the job, it will invite neutrophils. After neutrophil comes the next level, lymphocytes comes. Once lymphocytes comes, then another mechanism starts to trigger off. That is what? A humoral mechanism, which involves antibodies and cytokines and complements and things like that. So your humoral mechanism involves the action of antibodies and complements. You understand this? So the entire process now goes into another level. Is that understood? So now these neutrophils are going to come out and defend the microbial, whatever the microbial threat it is. So this is the normal mechanism that happens. So when you have deposits in the gingival sulcus, body gets the signal to do something, and the way body responds is either by the physical barrier, that is junctional epithelium itself will prevent the microbe and microbial products from entering. If by any chance the threat is bit high, it brings in neutrophils. If threat is still high, what will body do? The microbe over here has started to show its real color, or the microbes over there is now overpowering your body. If microbes are overpowering your body, which is much beyond the level of defense from the physical barrier, or even from the circulating neutrophils that has come here, or from the next level of lymphocytes and its antibodies and complement features, what will the body do? What will the body do? What will the body do? What will you do to your enemies if you find them too strong? Will you still attack? Then? If you find your enemy too strong for you, what will you do? Will you stay there and face all the threat and the insult, or move away? Move away. Move away. This entire epithelium will shift down. Will shift down. Move away from the microbe. But body is very, very smart. Body is so smart, moving away indirectly means finally excluding this microbe away. It's not that you're going to run away. Moving down ultimately should result in microbe being expelled. You know how the body does it? Body will move from here till here, from here till here, and finally till here. Now what will happen? The body has moved down, sufficiently down, that the tooth becomes mobile and gets exfoliated out. Where will the microbe go now? See how smart body is. It appears to be facing a failure. Junctional epithelium and the entire periodontium appears to be facing a failure, that the threat from the microbe is so severe that it has to keep itself away. And finally what happens? It throws away the tooth itself. Now where are the microbes? The gingival sulcus will unite from all the sides. Extraction socket will close. Where is the microbe now? Microbe is on that tooth, which is right now outside the oral cavity. Will the microbe survive on a tooth outside the oral cavity? Now who is smart? The microbe or the body? The body is definitely smart. But what happened to the tooth? What happened to the tooth? Who is smart? You, the enemy, or the weapon that you use? Who is smart? You, the enemy or the weapon? Naturally you. Who has to be sacrificed? At least one bullet has to be sacrificed, right? At least one bullet or something has to be sacrificed to kill an enemy, right? And who is the weapon here now? Or which is the weapon here? Weapon is tooth. Tooth is lost. Ultimately resulted in microbe is no more there. Body is completely safe. What is lost from here? The tooth is lost. See what happened here? Normally these police people carry a revolver in a pouch or whatever it is. It's not even taken out. Once it's taken out, a bullet is lost. Or few bullets are lost, but somebody lost his life, and he is safe back inside the pouch, but bullets are gone. Similarly, IoT. Your 32 bullets will go, but body will be safe. Did you understand this mechanism? So what is body trying to expel? Body is trying to expel that potential pathogenic microbe. In the process of it, what happened? Tooth is lost. Can you blame body for this? No. Is there any other organ in the body that harbors this much of threat? Nowhere. Nowhere. No other organ in the body challenges body itself by harboring so much of microbe, giving so much of threat to the body. That's the only thing that is tooth. So naturally body will expel that tooth off. Now where is the threat? There is no more threat. Is that clear to you? Unless you understand this particular mechanism, you will not understand periodontitis happening in a patient's mouth. You will keep on wondering what is wrong with that patient. His teeth are all mobile. What is wrong? Wrong is this. Wrong is either it is creating a real threat to the body or body is identifying it to be a threat. It could be both way right. You are having a revolver with you, you are having bullets with it. Are you going to kill the real enemy or a person who is under a small suspect? Or is it a wrong person? You don't know. But body has finally decided it to expel the tooth in a reality of expelling the microbe. That has happened here. Now should that be happened or not? That we do not know. But body identified it as an enemy. If body identified it as an enemy, it will do this procedure. Whether it was a real threat to the body, nobody knows. But body identified it. Is that clear? Is that understood? Even we do the same thing, right? We do not know the one whom you are really fighting with. Is that your true enemy or your friend? We do not know. We do not know. The same thing happens with the body as well. The same thing happens. So, microbe threat, body is trying to withstand it, body is trying to prevent it, net result, loss of tooth. Is that clear? So this is exactly, this is the precise mechanism of periodontitis as a story. Now what micromolecular level way or in a molecular level, what exactly happens here? What will cause this migration of epithelium down? How will the bone resorb? How will finally the tooth exfoliates off? How is that mechanism? What is the mechanism behind it? How does body achieve it? How does body successfully reject a tooth? That mechanism we need to know. You know why? Why do we need to know the mechanism? Because the only place a dentist, the only place a periodontist can come in between is sign a treaty in between. What is your problem now? This is my problem. Okay, I will rectify it. A dentist comes in picture exactly here and do a scaling. What was the threat? Microbe was the threat. So what is it? Because colonization on the tooth surface. Now what is your problem? I cannot remove it. If it was on my skin, I would have exfoliated off the epidermis layer, that dirt would have gone. But tooth, I cannot do anything. Okay, I will do it. I will do what? I will do what? I will do scaling. I will remove that microbe and give. Will you be silent? Yes. Until it come back again. You got it? You got this point? You got this point? Now this is to be done by whom? A dentist or a hygienist? should be teaching you to take bath properly? A skin specialist or your mom? Who should be doing the scrubbing for you, the real scrubbing for you? A nurse or a doctor? So this part of scaling is meant for, this part of scaling is not meant for a periodontist or a dentist. These are meant for hygienists. A scaling part or a cleaning part without knowing what is going to happen next is by a hygienist. If you are going to do this, then you are not going to do with an intention of just removing the dirt. You are going to do you are going to sign a treaty with the body that I will make sure that it will not happen again. That becomes a dentist scaling. Do you understand the difference? If you are a doctor, then you should be treating this area not just by removing this micro from here. You should be signing a deal with the gingiva saying that I know what is the problem here. Your problem is not just the microbe that is there right now on it. Your problem is still it can come. I will take care of it. That becomes a dentist scaling. If you are going to do a just simple scaling from there, removing as much as deposits right now there, you have done a hygienist job. If you are going to do a proper job which will prevent any kind of a threat in this area, including removal of calculus, then you are doing a dentist job. Do you understand the difference between a hygienist and a dentist? This is the thing. This is the thing. If you are going to do just removal of deposits from there, you are doing a hygienist job. If you are doing a procedure that will prevent from happening that thing again, then you are doing a doctor's or a dentist job. Anywhere near it? Anywhere have you understood it? We teach the proper brushing habit to the patients in dental clinic. It should be taught by their mothers or in schools. Are you going to sit and teach a person how to brush your teeth at the age of 55? That should have taught to him at the age of 6 months. Something important that happened at the 6th month. What was that? And you're going to teach that person how to brush teeth at the age of 55. That you in a dental college. That should have been taught to that person at the age of probably 6. Do these students start their schooling at the age of 6 months? No. Then it has to be somebody from home or who takes care of that person. Not you. Not you at all. If you happen to have a condition where you have to teach him, that means he has already started losing to that level. He has already lost his periodontia. Now you start teaching him, it's of no use. It's of no use. You should have started it at the age of probably the time of eruption of that tooth. Is that clear? Is that understood? I am just differentiating yourself between a hygienist and your kind of scaling. Your kind of scaling is a treatment. Hygienist kind of scaling is a professional brushing. A professional brushing, not personal brushing, professional brushing. That's all. It can happen again. The whole disease can happen again. So what exactly happens here? What exactly happens here when there is a threat? I am going to redraw the same area where there is a tooth and genital epithelial cells and bone up here and periodontal ligament and gingival fibers here. Can you follow this area? Can you follow this part? This is gingival sulcus, right? This is your CEJ. So in the gingival sulcus area, where you have an opposing hard tissue and a soft tissue pocket, what happens here? When there is a threat from what? What is the threat here? Microbe. Microbe has come here. Epithelium is going to signal. Signal to what? Signal to the to the next level. That's what we already said. So the signal from the microbe very successfully reached the epithelium. Epithelium will signal through its resident leukocytes to the resident leukocyte in the connective tissue. Connective tissue, that leukocyte residing in the connective tissue, the mast cell will release histamine. That histamine will result in or will make the vessel dilate. The vascular dilation, vasodilatation, and neutrophil start coming in. There is an influx of neutrophil from the vessel, and that my neutrophil will reach here and kill the microbe. Is that clear? How will it reach there? Is the neutrophil going to come out and wait there? No. Neutrophil has got a chemical gradient that will exactly drag the neutrophil from the extravasated area to the sulcus. That's what we call as chemotaxis. A chemical gradient that will mobilize the neutrophil that has extravasated out to this region. So it will come exactly from there to here. Okay. So now to know how does this entire process happen, that will result in migration of the epithelium down and the exfoliation of tooth, you need to know about this junctional epithelium. This junctional epithelium per se, if you see the junctional epithelium as such, this is divided into three portions. Functionally, junctional epithelium is divided into three. Functionally, junctional epithelium is divided into three. That is this area of the junctional epithelium. We are talking about this area, right? This area has got functionally three different purposes. This part, this portion is permeable. The coronal portion of the junctional epithelium is permeable. It has to be permeable. Because anything that has come outside has to be non. Am I right? Because microbe has come in here, right? Microbe is there here. So this area is to be permeable to all the chemicals, not this area and this area. The top portion has to be permeable to sense what is there outside, to sense which kind of a microbe is there outside. It need to analyze it through its products, right? So the microbes will send its product, and this coronal portion of the junctional epithelium will sense it. So it has to be permeable. And the center portion gives attachment. Center portion is attached to the tooth surface. So permeability stops where? In the coronal portion. It cannot enter the attached area. It cannot enter to the next area, to the apical area, no way. So the middle portion is for attachment, and the apical portion is for migration. Migration means what? Migration is move along. It has to move, not dislodged. Migrate means move. You are going to move exactly in the intact way it is. So this is how junctional epithelium is separated. So this junctional epithelium, what you see over here, is functionally divided into a permeable area, the center portion that gives attachment to the gingival cuff, and the down portion which are ready to migrate if body says. If body says migrate, it will migrate. Till that time, it won't. So till that time, it's part of your attachment, but not at all permeable. Microbes are allowed to stay only in the top layer. Don't come down. If you come down, then naturally these neutrophils are going to kill it. Is that clear? Is that clear? If microbes enter this permeable area, agreed. If microbe enters the attached or migratory area, neutrophils are going to kill it. Neutrophils are going to definitely get rid of that particular, whichever the entered microbe or the product is. It could be a molecule, it could be an oligomer, it could be anything that is totally destroyed from here. So this junctional epithelium has got this function of even migration. Any signal in this area, it will migrate down. Only thing is waiting for it. Understood? Now, which is that epithelium and vessel caesar? Now, what is that thing in between these two? Taut, strong fibers. connective tissue fibers. Connective tissue fibers are attached to the root surface. So if at all the body has given a signal to this epithelial cell to migrate, this portion to migrate, still something won't allow it to migrate. What is that? This strong connective tissue fibers here. Even if epithelium has to migrate down, the connective tissue fibers underneath it, it's not going to allow it to happen. Did you notice this area? So this is bone, this vessel is ready, bone is here, epithelium is ready to migrate down. Now why should it migrate down? The same thing what we said earlier. It has to exfoliate the tooth, right? Just to keep itself away from the microbe. So that is the mechanism, right? But the problem is to migrate it down, these fibers are not going to allow it. Now it has to have another cell in now, cell between. So not just the epithelial cells, not the neutrophils. Which cell should give permission to that fibers to give way? Which is a cell that produces it? Fibroblast. So fibroblast only alone can help you for a migration of epithelium down, because these are all collagen fibers. These collagen fibers can be destroyed by only one thing, that is collagenase. Collagenase are produced by what all cells? Which all cells? Collagenase are produced by even neutrophils. It's produced by neutrophils. They are produced by epithelial cells. They are even produced by fibroblasts or primarily produced by fibroblasts. So all those cells can collectively destroy this collagen. You understand? It can collectively destroy this collagen. That will help the gingiva to migrate down. Why should it migrate? We have already told this story. It should migrate for a particular reason. So tooth has to be exfoliated off. Right? So now, as soon as this neutrophil come out of this place, that is your vessel. As it diapetes out, as it zipper in a zipper phase, as it moves out, transendothelial migration is completed, and the neutrophil is right now here, outside the dilated blood vessel. Here is the neutrophil. The neutrophil is chemically being attracted to that particular area. That is chemotaxis. It has to reach here, right? It has to reach here. Now, how will it transverse all these thick, tough connective tissue fibers and the epithelium and reaches there? How will it reach there? By chemotaxis, by releasing collagenase. Or when it reaches here, whichever protein is there, it will give its own enzyme and kill that particular protein and enters and goes through that area. If reticulin is blocking it, reticulinase is released. If collagen is blocking it, collagenase is released. So whichever comes in between, the enzyme is produced and destroyed, and the neutrophil just migrate to one particular area where it is required, where it is recruited, that is here. So now neutrophils came out. It will release what? Collagenase, because immediately it is collagen that is blocking it. It will release collagenase and it will break this collagen. It will break the collagen. Similarly, when there is a signal from there, fibroblast will start its job. It will start lysing the collagen. So the fibers in between the vessel and the epithelium, these fibers will start to get lysed immediately. So that means the support of the epithelium is lost now. Is that understood? Epithelium has got thick fibers here. Now that is lysed. So this portion is lysed means epithelium loses its support. All this time epithelium was held in proper place by the underneath connective tissue. Connective tissue starts becoming lysed. It will start becoming edematous. Now there is no more support for this epithelium to hold the area or cling on to it. Is that understood? So the epithelium is not going to stay stable now because the underneath connective tissue is lysed. It's become hollow underneath it. So this epithelium to give or to stay attached, you know what will they do? Once this epithelium loses its support, it will extend its leg. It will extend its leg from here to one cell down. So once epithelium loses its support, it will step one step down to get a better hold on it because it's losing its support. Naturally, when you lose your support, you will tend to hold on to something, right? Similarly, when your epithelium is this much here and it loses support underneath, it will extend another one cell down and try to hold it onto the lower level because it has got a capacity to migrate. So another layer of cell or a cell by itself is formed here which will hold on to the root surface one step more. Now what has happened to this epithelium? Epithelium which was only this much has now become this long. Epithelium has broadened. Epithelium has broadened. So the attachment is more. Am I right? Is that clear? Is that clear to you? So the epithelium becomes broadened here. So all because of these fibers being lysed. Fibers being lysed because of what? Neutrophil has to give way. It has to release its collagenase. So naturally the fibers are getting destroyed. Epithelium will get broadened. Is that clear? So now the epithelium has become this broad. One cell extra. It was only this much, it has become this much. Clear? So permeable part, attachment part, migratory part plus one more cell over here. So it has broadened out. Is that understood? Now all these neutrophils are going to get an influx to this area because there is a threat over here, right? So too many neutrophils are going to come here. And all these, if you see the junctional epithelium, if junctional epithelium had 100 cells here, if junctional epithelium had 100 cells here, that will be added with another 100 neutrophils. Won't it happen there? Won't it happen there? You get this point? Neutrophils from blood vessel, where is it going to go? Here. Right? So it was only junctional epithelial cells now. Now what has happened? All these neutrophils have joined this junctional epithelial cells. So if junctional epithelial cells were only 100, now this has become 200 cells. Right? 100 fixed cells filled with 100 unfixed cells, free cells. Neutrophils are not bound to each other. They are free. So all these free cells are going to come and populate in an area. Something like it's few many neutrophils come and sitting in between you. You are all fixed onto your chairs. If some neutrophil comes and sits between you, similarly, this area is going to be filled with neutrophil now. How many of our junctional epithelial cells were there? That becomes irrelevant because too many free cells are going to populate to that area. Clear? Understood? Just imagine that area. This area is now one epithelial cells and 2 or 3 neutrophil cells. Too many things influx to this area, and all these things are populating in the permeable area because there is the maximum toxins or micro permeable area. So once this particular area is filled with more than 50% of its own cells, what will happen? If this sulcus area, the epithelial cells that is here, if it is more than filled with more than 50% of cells, that area will detach. That area will detach. So top portion gets detached. So this portion gets detached. Now what has happened to the width of the epithelium, junctional epithelium? It had already migrated one cell down. Now one cell is detached. Now what has happened to the width? It has retained its width. One cell down, one cell detached from top. One cell migrated down, one cell detached from top. So the width is now the same as earlier. But what has happened to its position? From here, just come to here. What is this process? A planned, programmed precision. Gingiva is coming down. Now, who's going to win finally? Who's going to win finally? Remember, it is body itself. Because body's objective is only one thing. Somehow, permanently remove this threat area. Permanently remove this threat area. This threat area is this. This area, which is going to constantly give a threat. Body wants to get rid of it. Clear? One cell down. Now what will happen? There will be more of deposits here. Right? Because now it has become a pocket. You cannot even maintain that area. There, otherwise it was okay. Now that it's a pocket, right? More microbe will accumulate there. What will happen to more microbe? They will get harbored there, happily sitting there. They will colonize the area. This microbe will happily colonize this area like a housing colony. Neutrophils will come down from there. They will try to protect it from entering the body. It will keep on protecting it from entering the body, but junctional epithelium will migrate down. Junctional epithelium, as it migrates down, the bone will keep on resorbing down. See how planned body is. Junctional epithelium, as it prepares to migrate down, bone will resorb down. Junctional epithelium comes down, bone will resorb down. To a certain extent, tooth will start shaking. Still it will keep on going down. The smart microbe will keep on colonizing. The smartest microbe will keep on colonizing. The real smart body will slowly migrate it down and finally the tooth will become shaky and the tooth will go out. This process is called, this entire process is called periodontitis. This is what is periodontitis. If it was limited to this level without migration, if it was limited to this level without migration, what will you call it? Gingivitis. Limited to that level with some amount of redness, some amount of edema. If you touch that area, it will bleed. All those things are limited to gingivitis. If it is not arrested at that level, what will happen? It will progress to periodontitis, retaining gingivitis. Gingivitis will still remain. Gingivitis will be always there, but migration. So where does it differentiate between these two processes? Where is it limited to gingivitis? When do you call it periodontitis? You should be able to say that now. An inflammation of this process without attachment loss. The entire process of inflammation without attachment loss is what? Gingivitis. With attachment loss is what? Periodontitis. When inflammation is happening in this area with loss of attachment, we call it periodontitis. An inflammation of that same area without loss of attachment, that means body is trying to withstand it very good. Only the investing structures need to prevent it from happening. That is gingivitis. This is happening in your mouth. But when does the other one happen? When body identifies this as a threat. Presently, with your healthy condition, with your kind of a defense mechanism, body doesn't identify any microbe as a threat at all. So what will body do? Body will defend it by gingivitis. Simple gingivitis. At a time when you started getting some kind of a debilitated condition, when you start getting some kind of a disease by else, which is going to affect your defense, like crude way you can call it diabetes. In a crude way you can call it diabetes. Reality is what? Less of energy. You don't have energy to defend it. When you don't have energy to defend it, when you have other things to take care of it, body will give way. Body doesn't want to have this border of control. Body doesn't want this area. If body doesn't want this sulcus, only thing what body can do is remove this hard structure from there. Very programmed way of exfoliating a tooth and finishing off it forever. This is called tooth loss. So it starts with what? A change in color. Ends up with what? Not just loss of tooth, restoring that area properly. As a child, you never had a gingival sulcus before eruption of tooth. Before 6 months of age, you didn't have tooth. That time you didn't even have a gingival sulcus. The tooth erupted, gingival sulcus came along with it. At certain age, you lose your tooth. You cannot even recognize which area was the tooth placed. That area will be again back to the normal mucosa. You cannot identify an area which had tooth earlier. It will be an edentulous area. It could be a canine, it could be a molar, or it could be a central incisor, something which was sitting there. Now, right now, you cannot identify it. In a newborn baby's mouth, you cannot identify a sulcus. You cannot identify an area where the tooth is going to erupt to, because the tooth is not there. Once the tooth erupted out, sulcus came. Once the tooth exfoliates off or you extract it off, the sulcus disappears. We place an implant in that area, sulcus comes back. By any chance, if that implant gets exfoliated off, sulcus disappears. In reality, there is nothing called sulcus. It comes with the package of a tooth. Understood? So ultimately, what does body do? Body closes off that sulcus area by removing the tooth from there. Now where is the threat? It's just like any other part of the body. So dentistry has now become part of medical science. As long as tooth remains there, it is dentistry. Once tooth is lost, it is part of the medical science. So as long as tooth is there, it is dentistry. So don't kill it. Don't kill it. If you remove a tooth, you have lost a patient. For an MBBS person, when you see a patient walking in, it's just one patient. For a dentist, it is 32 patients having 32,000 problems. Are you in search of problems or solution? You are in search of problems so that you can find a solution, so that you can happily lead a dentist life. Otherwise, what will happen? Body will find a solution. You people doesn't exist in this world. Nothing will happen. If you are not there, body is there to take care of tooth. But body will do what? Body will get rid of any need of a dentist by doing this mechanism. So, are you in a hurry to learn extraction? Don't learn extraction. You don't need it. Never. Situation should come to such an extent that nobody needs the mechanism of extraction anymore. Even if it happens, don't leave that area. Place another tooth there, exactly like this one. Which is that? Which is that alternative? Whatever the thing is, implant. Presently it's implant. Tomorrow you don't know what is going to be. So, extraction should be such that you should talk to the body and make the body understand that we'll give a better trouble to you. It's not going to end. Till now it was what? Body was smart enough to say that if you lose this tooth, problems won't happen again, right? Now we are into such a problem, or we are into such a problem creation, saying that even if you extract tooth, we'll place implant and give you another problem. So this problem of periodontitis is never ending. As long as tooth is there, the chance of periodontitis is there. As long as implant is there, the chances of small change in that word. What is that? Peri-implantitis is there. As long as tooth is there, periodontitis is there. As long as implant is there, peri-implantitis is there. So the itis will continue. Itis is life. If you lose itis, you are dead. Is that understood? Is that clear? Yeah. Any doubt? Any doubt?